group was established fairly recently to bring together 40 to 50 charities, voluntary and community groups that are all working in this sector to make sure that we can coordinate how we do things together, everyone with the aim of improving services for islanders.
I think we all provide great services on our own, but actually we can do so much better if we work together. I think the thing that I have found amazing tonight is how often co-production has been mentioned, because for us that is, a massive piece of our bread and butter and what we've been trying to promote for years, and it is absolutely the right model for us to be adopting across all of our healthcare services. So to see it being front and centre in so many of the presentations tonight was an absolute thrill for me.
There are some really significant common themes coming through. So you've got inequality of health outcomes for islanders. That's really critically important for us to look at and understand why that's happening to the extent that it is. It's really important that we understand earlier interventions so that we diagnose earlier, and it's coming through in everybody's talks and discussions that we need to have a better understanding and better interventions at an earlier stage, more prevention. So look at healthy heart, healthy brain, look at dementia, look at other long-term conditions and how we can diagnose those earlier and improve outcomes and quality of life for islanders.
The topics we cover include looking at mental health issues, looking at some of the promotion and prevention issues that we can do, and also beginning to think as well about dementia and how we're going to look after people going forward.
It's a small island, and yet it can seem very large and bewildering if we don't all get together and learn what each other's doing. We don't want to duplicate services, we want to augment what we do rather than work in small individual silos.
Common themes are that we need to be talking about mental health. We need to remove the stigma, and we also need to be able to signpost people to robust services that can help. But that starts from within the organisations.
Me and Andy sit together and we sit there and we discuss, is this going to work? And I said to him, well, from my experience, it's not going to work. And he's like, right, scrap that. We'll go back to the drawing board. We'll write it out again. And so working with professionals and service users, it can make an experience because someone understands it, like myself for 15 years in services, knows the service better than anything.
Today is really useful to hear other people's perspectives. Often, you're just discussing within your organisation amongst your colleagues, so it's nice to communicate and discuss matters with other organisations and agencies and get new ideas and basically just a different perspective on things, and it's just a bit eye-opening.
I feel like I've walked into a room of almost like a group of friends, because as I look round, we're in a space where loads of kind of pop up people telling about the different organisations, and already so many of them actually use our space. So it's fantastic to be in this room and go, wow, we already work with these people, but then to build on those networks is fantastic. And then it's all about, right, how can I get you the support and the right help? So for being here and being able to network with people means that I can have more understanding and hopefully then be able to help people in the right way.
The real importance about tonight and events like tonight is that all of the different organisations involved in providing care for islanders and being involved in supporting islanders can get together, look at issues that are themes that we all need to address, but we can't address that individually. We've got to do it together, and we've got to include islanders in the approach to new services.
We love the opportunity that we have to be part of the Health and Care Partnership Group. It gives us that opportunity to contribute to the important work that we're able to do in a small community. Really, really important to have the opportunity to have that voice where we can highlight what the challenges are, but how we can actually deliver really positive outcomes for the community that we're all working in. So we love the fact that we're a part of this organisation and that we're able to contribute to make really positive outcomes for islanders.
It's just been such a positive event. I mean, to see everybody face to face is one bonus. I think what we've seen during the pandemic is charities government, funders, private sector all came together to help support islanders in the pandemic. I think we just need to keep that momentum going as we develop our health service. All the tools are out there, all the pieces of the puzzle are out there. It's actually how we pull them together and work collectively. That's the key to it, because if you look at, we've got 450 fantastic charities, we've got some fantastic funders, we've got some amazing professionals, we've got the parishes, we've got thousands of volunteers, we've got fantastic GPs, and we've got some fantastic facilities, and really we should be looking at how we pull this together. And this sort of event allows you that dialogue and that discussion and that challenge. So I'm really hopeful that we can co-produce the most amazing service for islanders and future generations.
This has been an incredible opportunity to meet members of the healthcare and social community from across charities, from across the government agencies, and from other professional organisations to really begin to understand how the jigsaw fits together. And I think a real network was beginning to form this evening, which can only be a good thing.